Good morning.
Good morning.
How are you?
Good. How are you?
I'm doing well. My name is William Crawford. I'm a doctor of physical therapy student at Pecan, Georgia. And kind of just want to see what we got going on with that elbow, okay?
Okay.
All right. Real quick, can you give me your first and last name?
Sierra Perez.
Gotcha. Can you give me today's date by the chance?
Not 4:27.
Okay. Can you give me the time?
It is 3:43.
Awesome. All right. Sierra, what we doing here today?
So my left elbow's been giving me some pain, kind of sharp and achy.
Yeah. What do you think has brought that on?
The only thing I can think of is my job. So I am an assembly worker, so I'm constantly like reaching out and unplugging things.
Okay. Gotcha. Right now, on a scale of 0 to 10, how would you rate that pain?
About a 7.
Oh, about a 7. At its worst, how would you rate that pain?
Probably a 10,
A 10.
especially after work.
Yeah. Okay. What do you do to kind of, I guess, relieve that pain in any kind of way?
I just try to go home and relax it. Maybe ice it sometimes. That kind of helps a little. Try not to use it as much, maybe.
Yeah. Where exactly on that elbow do you feel it the most? So is it kind of like this pointy end? Is it more inside the arm, outside the arm?
I would say it's a little bit more on the inner.
Yeah.
Inside of it.
Okay. Let's see. Is there anything at home or just outside of work that irritates it or makes it flare up?
None that I can think of.
Okay, gotcha. What about like, I don't know, like if you're pulling anything or if you're carrying things, like.
Oh, well, yeah, I guess like maybe carrying groceries.
Okay, gotcha.
I feel like just an overuse of it, depending on what I'm doing, can cause it to be that pain to increase.
Gotcha. And you said it was a deep, achy, sometimes sharp pain. Okay, gotcha. Have you had any prior treatment for it?
No.
No? Okay. Have you had any numbness or tingling in that arm?
I don't think so, no.
Okay, good. Have you had any prior injuries to that arm? No? Okay, good. Do you have any like comorbidities like diabetes, heart disease?
No.
Good. Okay. Yeah. Let's see. Are you on any medications right now?
No, nothing like prescribed. I just maybe some ibuprofen some days, but
Right.
that's it.
Gotcha. All right. Are you left hand dominant or right hand dominant?
Left hand.
Left hand dominant. Can you show me one more time how you pull those plugs?
Yeah, so it's constant.
Yeah. Okay. Gotcha. Okay. If you would say that you have any goals after this, what would those goals be?
I would just say just figuring out ways to continue to decrease the pain on it, especially like after work. Maybe strengthening it if I can.
Right.
Yeah, just like general mobility so it doesn't stop me during my day-to-day tasks.
Right. Okay. Gotcha. Is there anything you feel like you need to tell me before we get started or any questions?
I don't think so.
Gotcha. All right, so we already ran blood pressure, respiratory rate, heart rate, looked at your balance, gait, stuff like that. So we'll go ahead and get started with the exam. So real quick, if you don't mind, I'm gonna have you look up towards the ceiling. Good. Also, if there's any pain during any of these tests, let me know, okay?
Okay.
All right. Now, can I have you look down towards the floor? Good. All right, you can look back up. Can I have you look towards your right? Good. Now look to your left. Good. You can look back to the middle. Now, can I have you take your right ear and touch your right shoulder like that? Good. All right. Now, same thing with the left ear. Good. How are all of those? Is it okay? Good. All right, real quick, can I have you stand up? All right. this way a little bit. All right. Can I have you bend down and touch your toes for me? You can come back up. All right. Can I have you lean back as far as you can? Good. You can come back up. All right. Can I have you take your right hand to reach your right leg or your right side of your knee? Good. Same thing on the left side. Good. You can come back up. All right. Kind of hands in the middle. Good. All right. Can you rotate to your right for me? Good. Rotate to the left. Good. How are those?
Fun.
Good. All right. You can take a seat. All right. All right. So can I have you shrug your shoulders up? Good. You can relax them. Can I get you bring your hands all the way up like on a roller coaster ride? Good. Bring them back down here. Can I have you kick them back? Good. Come back here. Can I have you spread them out? Come back down. Awesome. Can I get you here? All right. Give yourself a great big hug. Good. Open up for a big hug. Good. All right. You can come back here. All right. Palms up. Can I get you to kind of bring these arms up like that?
This one has a little pain.
Really? That one has pain? Where is this? How would you where would you describe that pain at?
That upcoming motion.
Okay. Anywhere specific on the elbow, so like on the pointy end or more inside or more?
Just more that inside.
More that inside, okay. Gotcha. All right, so back here. All right, and we're gonna come down. Good. You can come back here. All right. Now can I have you bring both hands up? Good. How's that? Good. Okay. All right, we'll bring them down.
That's a little pain there.
That one's a little bit painful. Okay. All right, we can come back here. All right. Can I have you kind of turn your palms down? Bring them back up. Good. Can you do a little windshield wiper? Good. All right. Can I have you spread them open? Good. Close the fist for me. Awesome. You can open it back up. Good. All right. Okay. Now I'm going to take a look at some of your strength. All right. Shrug those shoulders for me. Good. Don't let me push you down. Good. All right. Now I'm going to have you bring your arms out right here. All right. Don't let me push you down. Don't let me pull you up. Good. Real quick, I'm going to have you kind of come here towards the middle. Open up for me. Good. Come back to the middle. Good. All right. Come back here. All right. Don't let me push you in. Good. Don't let me push you out. Good. All right. Get you here. All right. Don't let me push you down, okay? All right. That one hurts again? Okay. Don't let me pull you up. Good. Let me have you right here. Don't let me push you down. Good. Don't let me pull you up. Good. All right. So here, get those. All right. On this hand, I want you to grab this. All right. I want you to turn in against my hand, okay? Don't let me pull your hand up. All right?
Oh, sorry.
No, you're fine. I'm gonna get you right here. You can relax right here. Yep, good. All right, so I'm gonna pull it out this way. I want you to go that way, okay? All right. Good. All right, I'm gonna go this way. I want you to kind of go palms up, okay? All right. Good. Same thing on this hand. Don't let me turn your palm up, okay? All right. Good. Now don't let me turn your palm down. All right. All right. Good. You can relax. Let me get your hands so kind of here. Good. All right. Don't let me pull them, okay?
Ooh.
That one hurts?
Yes.
Okay. All right. Go here. All right. Don't let me pull your hands out, okay? All right. That's fine. Okay. Good. All right. Hands back here. Maybe kind of. Well, matter of fact, you can go right here. Yep, just like that. All right. Don't let me push it out. Good. Bring them here. Don't let me push it in. Good. Same thing on this hand. Don't let me push this out. Oh, bring
No.
it up. Yeah, you good. Good. All right, we'll go right here. Don't let me push it in, okay? All right. Good. You can relax. All right. Those. All right. Put your fingers together for me like this. Don't let me spread your fingers apart. All right, you can relax. Make a fist for me. All right, open them up for me. Good job, good job. All right. I do want to look at some, I'm just going to apply some overpressure to the elbow. So I'm going to start with this arm. What I want you to do is you can, well, just try to relax for me, okay? All right, so I'm going to push down. Let me know if you have any pain. How's that?
That's fine.
Okay, all right. Now we're going to come up. How's that?
That's fine.
Good. All right, you can relax. How long have you been an assembly line worker?
Maybe 2 years now.
2 years? Gotcha. My cousin's an assembly line worker.
Okay.
Yep. Again, let me know if you have any pain, okay? All right. How's that?
It's a little alright.
Okay. All right, we're gonna come up here. Let me know if you have any pain. Right there.
Yeah.
About where would you say?
About right when the elbow starts to.
And then.
Mm.
Okay. All right, we'll relax. All right. Might do some overpressure on this just to see. All right. Again, let me know if you have any pain. Okay. All right. That's fine. That's fine. This wrist.
Oh.
Yeah. Come up. How's that?
It's a little, but not much.
Okay, gotcha. All right. I want to get a little bit of a couple of measurements. We'll start on this arm first. Yeah. All right.
Relax it.
Yeah, you can relax it. I'm sorry about that. And then kind of open up that hand for me. Good, just like that. All right. Try to relax. Let me know if you have any pain, okay? Go right there. All right, you can relax. Oops, sorry about that. All right, so I had you at, let's see, 130. Right. So same thing. Yeah. All right. Kind of straighten out that arm for me. Good. All right. All right. Kind of open up that palm for me. All right, try to relax one. Good. Right there.
It's starting. I can start to feel it.
All right, we know we can't go anymore, okay?
Okay. That's
About
good.
right there? All right, you can relax. So yeah, so I got about 0 to 94 on that one. Okay. All right, we'll do a quick one on the wrist. So on this one. All right. Let's see if I can. All right, we're gonna go down as far as we can. About right there.
Fine.
Alright, so that's about 60.
Ooh,
Yeah.
yeah, that's tight.
About 30 right there. We'll go the other way.
It's a little pain there.
Okay, so that's about 60.
I think it's more pain on the outwards part. When you did it the other way.
Oh, okay. Gotcha. All right. I'm gonna do a couple of tests. I'm doing on this arm first. We know if you have any pain, okay? All right. How's that?
That's fine.
All right. Go this way. Try to relax for me. How's that?
That's fine.
Good. Okay. How's that?
It's a little pain, not much.
Okay. Then we'll go right here. How's that?
It's a little tight.
A little tight? Okay. But not too much pain?
No.
Okay, good. So this one, I'm gonna do one more test and let you, and we'll talk. All right. So I'm gonna have you relax. I'm gonna have this hand here. Good. So here. All right. So I'm just gonna bring your arm out. I want you to let me know if you have any pain. Okay. All right. How's that?
That's fine.
How's it?
That's fine. That's fine.
Okay. This one.
That's good. Ow.
Yeah.
Yeah.
Okay. All right. Well, that's gonna conclude our test. I do think some of that musculature right there is a little tight. So we're gonna address that at the next meeting, okay?
Okay.
All right. Do you have any questions for me before we leave or head out?
I guess just like with the muscles, like is it just because it's like being overused a lot?
Yeah. So a lot of times, especially if you're like pulling plugs like this the whole day, some of those muscles can get irritated, especially if you're not taking time to stretch them out. But yeah, we'll make sure we get ahead of that and try to get you back in there, all right? All right, any other questions or concerns?
Not at this time.
Awesome. All right, it was very nice meeting you, Ms.